So the first one started on his flank, and it's sort of grown bigger. It's very tender. He doesn't like having antiseptic put on it. Then he got one on his knee.
And you can see he's actually damaged the tissue of the wart, so it's all scabby and infected.
And this one is really tender, actually.
This is really bad.
And then he's got the one on his nose.
Gosh, he's absolutely covered, isn't he?
Yeah.
So the thing with these type of warts is normally they're just cosmetic, right? And a lot of older dogs get them and they don't cause any issues, so we say, right, we'll just leave them. But in Bert's case, they're obviously causing a lot of irritation and it's quite traumatizing for him. And he's just been chewing and chewing and chewing, and I'm guessing even through the night, you know, he won't even be sleeping properly.
Yes.
And you can see they're starting to get infected and really, really inflamed and tender. A problem like Bert's can actually affect his quality of life. All he does every day, every night is chew at these warts, and they're actually starting to bleed, they're becoming infected, they're inflamed. It's like having mosquito bites all over your body and the itching just won't stop. I definitely think for his quality of life, the best thing we can do is remove them.
What are we looking at, sort of risk-wise?
Risk-wise, so with any dog going under an anaesthetic, there are risks.
Right.
But obviously he's a 14-year-old dog, so he's definitely older. And it just means that sometimes the medications we use, the anaesthetic itself can hit them a bit harder.
You're kind of in two minds because you don't want to put your 14-year-old dog through anything unnecessary. So I feel slightly worried and apprehensive, but he's in good hands.
Let's go. Come. This way. This way. Let's go.
In the southwest of London, Michael and nurse Sarah are about to remove a series of warts, causing enormous discomfort to miniature poodle Bert.
Never-ending warts. I'm not sure clipping was the best thing to do because as we clip more fur, we're just finding more and more warts. So this is going to become quite a lengthy procedure. Normally, we would just leave these kind of warts because they're purely a cosmetic thing. But in Bert's case, they're actually causing a lot of irritation, and he doesn't go a single minute without trying to bite and chew these warts. And when that happens, they need to come off. I have lots of scrub hats. Got my dinosaurs on today. Yeah, that's perfect. Warts can be caused by a few different things. Sometimes it's just changes in the skin where you just get uncontrolled growth of a certain skin cell. It can be caused by irritation, viruses, sometimes certain types of cancer as well, just like in humans. The problem with a lot of these skin growths is that they often end up developing lots of blood vessels which go into the growth, which means that when you remove them, you have to cut through those blood vessels, and that's what can get a bit tricky.
As Michael removes the first wart,
that is one taken off, but that had a nice fat blood vessel leading into it.
he encounters that exact problem.
So I'm just putting a bit of pressure now to stop the bleeding. I've just cut into a blood vessel and there's a fair amount of blood coming out. That makes my job really difficult because I can't see what I'm doing. There's just blood obscuring everything. When you cut into a blood vessel while you're operating, you get a lot of bleeding and it isn't going to stop by itself.
Michael must stem the bleeding before his 14-year-old patient loses too much blood.
It's really difficult. If I don't stop this bleeding, he can actually lose a fair amount of blood. And then on top of that, this bleeding can cause bruising, swelling, and post-op infection. So I really need to do something fast. So you need to use some suture material just to tie that off. Okay. It's a moment of truth. There we go, did the trick. Brilliant, no more bleeding. 1 down, 8 to go. There we go. Lovely, big juicy wart. This feels like a never-ending surgery. Definitely slow, arduous work.
As Michael continues the painstaking task of getting rid of Bert's troublesome skin growths,
Okay, so that's 3 down.
the risk of uncontrolled bleeding looms large once again.
This wart's a bit trickier just because it's directly overlying the jugular vein. So I just don't want to go too deep because if I do cut into the jugular vein, I've got lots of problems. This one is giving me heart palpitations. And if I cut into it, I won't even know where to start. There'll just be blood squirting from all directions and it'll just be a huge chaotic mess. So I just have to be extremely careful with this one. There we go. That's all fine.
The wart next to the jugular vein has been safely removed.
Actually, maybe if we can have him in left lateral.
There's now just one lump left to remove, but it could be the most challenging of them all.
So this wart is quite tricky as well because you can see just how close it is to the eye, and there are lots of important structures around here. So what I'm going to do is move this so that it's over the bone, and that's just safer for me to go in with my scalpel blade.
In southwest London, Michael is about to remove the final wart from miniature poodle Bert.
I just don't want to go too deep.
It's high-risk surgery, as Michael will be operating perilously close to the 14-year-old's right eye.
So you can see just how close it is to the eye. As you can imagine, there's a lot of delicate structures around there, including blood vessels, nerves, and muscle. And if I do something wrong there, that can potentially affect his eyesight. Okay. Okay, let's give it a go. Okay, there we go. I'm happy with this one. It doesn't look like I've interfered with any structures underneath. 2 stitches left and we are done. So hopefully, no more itchy warts for Bert after this. Gosh, okay. We've finally removed all the warts from Bert's body and face. I think we've removed 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 warts, which took quite some time. I finally removed all the warts from Bert's skin and it's a huge relief. I'm so happy with how today went. Bert's quality of life is going to be so much better now.
Later that evening, Bert's loving owner Margaret has returned after a long and anxious day.
I think we just want to get him home now, really, and sort of let him rest and sort of have a bit of attention, really. I think he'd probably quite like that. I think.
Hey Bertie, hey Bert, come. You ready to go? Hey, do you want to see your mum? She's here. Come on, let's go. Boy, come. Don't worry. Come, let's go for walks. Hey, good boy. Come on. There we go.
Hello.
There we go.
Oh, hi, gorgeous. Hello, Luna. You've been in the wall, sweet pea.
Yeah, everything went really well today. We ended up taking out 10 warts.
10?
10, because as we clipped the fur, around some of the bigger ones, there were smaller ones there, so I've taken those out too.
Goodness me.
Okay. There were a few that were in quite high-risk areas. So the one on his neck was actually overlying the jugular vein, so we had to be very careful with that one. And then that larger one on his face as well, just underneath the eye. So I think now he's going to have a much better quality of life. He'll be able to sleep throughout the night without having to chew at his warts. I think Bert is going to be so much happier now without those warts, and I think Margaret's going to see such a change in his behaviour now that we've helped him. Great, so I'll leave him with you. Any problems whatsoever, just let me know, okay? No problem. He's ready to go.
Yeah,
ready to go. See you later.
All right, thank you so much, Michael. Bye-bye.